Good evening, everyone, and welcome to another edition of Let's Talk About It. This is Susan Johnson, and my co-host Dennis O'Brien is out doing great works here in the Windham area. So we have a wonderful, wonderful guest for you this evening, and a very good friend, and someone who's been on Let's Talk About It in the past. So I'm really thrilled to welcome our Human Services Chairman, Jillian Gilchrest. Welcome, Representative Gilchrest. Thank you so much for joining us.
Thank you so much for having me.
So I know you were on the show back in the day when we had the Permanent Commission for the Status of Women. And after reading your book, I didn't realize you also worked in the House before you did that. And you did a number of great things working on women's issues. And your book today is called The Feminist Advocacy, and with a foreword by Congresswoman Rosa DeLauro. And you're championing gender and social justice. So I'm really thrilled. The book is great, everybody, and we'll get into the book a little bit later. But first, I want to talk a little bit about how you got to be the state representative and some of the work you did before that.
Fantastic. Thank you. So interestingly, it all comes back to Willimantic, Connecticut. So my first job out of college was as a child advocate at a sexual assault crisis center in Willimantic, Connecticut. And it was doing that work where I realized that while I wasn't cut out for direct service, I was really interested in making what in social work we call macro change. And so I was drawn to kind of barriers with systems and why folks couldn't access care and how do we address poverty. And so I sought to work in the field of public policy and was able to get a role as a legislative aide and committee clerk at the Connecticut General Assembly, and then went on to do advocacy at a number of nonprofits in the state of Connecticut, going up to the Connecticut General Assembly and lobbying on behalf of gender equity issues. And so in doing that work, I knew from the time I went in that building, into the legislative office building, that someday I would run. With my background in women's studies, I had heard enough times that women have to be asked about 7 times on average to run for office. And so I was determined not to be that person, and to run at some point in time to represent my community and work for change in the legislature.
Wow, and when I read this book, I realized that we have a lot of things in common, although at little different time frames, obviously. But I did also work for the Sexual Assault Crisis Center back in the day when we had it here in the 80s, and I learned a lot, and I found out a lot of things that, really were of great concern to me, and that information has come in very useful to me in the legislature when certain proposals come up, and I'm able to say I have a history of working with people who have been assaulted as children, sexual assault as children, and have had horrible experiences that have had real serious psychological impacts on them as they grow up into adults. So, it's really was a very good experience. It was really an experience that working full time and raising my little one at the time, at some point I just couldn't. I realized too that wasn't the kind of thing that I could do. And working as an advocate for Medicare beneficiaries, I read lots of files and got into people's medical conditions, but rarely did I have actual interpersonal contact with somebody who had that kind of who I was helping. Although those were very moving experiences as well. Not that it wasn't moving to represent people that were having problems getting coverage, but when you see them also limited, it's very, very difficult. So
yeah, those experiences, I'm in awe and just so grateful for folks who do, the direct service day in and day out. But just remember it taking its toll, after a little bit there, and just knew, I don't think I can do this long term. So how can I help to make policy change?
And it's really interesting when you see people who do that work, whether it's police officers or EMTs, doctors, nurses, they're working with people that are having, real serious problems a lot of the time. And it really does have an impact on, your own feelings about how things are. So it can be very difficult to spend, day in and day out with those situations. So now I'm very pleased that you are the Human Services Chairman for the House, working with Senator Lesser on the Senate side. And you have been doing that, and you've been doing a great job. So tell us a little bit about the work that you've been doing as a Human Services Chair. Now, we just finished a Medical Assistance Policy Oversight Council meeting that I sat on with you, but that's just one aspect of what the Human Services Committee does. So tell us a little bit about where we are and what the Human Services Committee does.
Yes, so really proud to be chairing the Human Services Committee as a political social worker. And one of our biggest tasks is that we oversee the state's Medicaid program. And about a third of Connecticut residents actually receive their health care through our state's Medicaid program, and 1 in 3 children. And so right now the major focus is on ensuring that we can bring our Medicaid rates up to what they should be. And when we're talking about rates, I think sometimes we get lost in the political jargon. Rates is the pay. So how much are we paying for health care? And Connecticut hasn't increased those rates for a very long time. And so it's a twofold issue. It's impacting people's ability to be able to access the health care they need, but it's also impacting the workforce because we're not paying a variety of healthcare professionals what they deserve to be paid for the care they're providing. Additionally, in the Human Services Committee, we work on TANF, Temporary Assistance for Needy Families. We look at those experiencing homelessness. We work on issues with nursing homes. We work on issues impacting individuals with intellectual and developmental disabilities. So really, it runs the gamut of what you'd consider human services.
Yes, it does. And all those areas that you just spoke of have their own sets of rules, and they're all very complicated in terms of the rules. And one of the things that we work at is to try and make sure these programs that you just spoke of are being made available and people understand how to access them all throughout the state.
Yeah, exactly. And I know many of our colleagues in the legislature reach out, I'm sure to you, to myself, because they hear from their constituents who are trying to access services. And so we also, as chair of the Human Services Committee, kind of a point person for my colleagues in being able to connect them to the people they need to talk to so they can get those services for folks in their community.
Yes, and I think that as a legislator, as somebody who's on the Human Services Committee, and even if you're not on the Human Services Committee, for people listening, maybe they're not in my district. I represent, as you all know, the 49th House District, which is the whole town of Windham. But if you're looking at the need to connect on some of these services, these human services, contacting your state legislator to help you make those connections is a big help because a lot of the times there may be some confusion about how to connect or, some frustration because the connection didn't work. That would be something that you want to make sure your local representative knows about and that they're able to, connect with the State Department of Social Services to try and make sure that all the things you need, because you're inquiring about your need for services, are made available to you in accordance with all of our rules. So I think that we're very happy that we have a number of people around here that know enough to contact us, and then we know enough to go and connect with the Human Services people and at the Department of Social Services and try and make sure that they are informed about maybe some of the problems and things that people might find when they try to connect and make sure they get access to care. And so many of the places around our state, like Windham, like Hartford, New Haven, Bridgeport, Waterbury, all these different places have homeless shelters where we're working really hard to make sure people have access to services through the Department of Social Services.
And you make a really good point, Susan, because I think oftentimes when folks are trying to access services and they're facing some type of barrier, they just kind of throw their hands up and assume this is the way it is. But when you let your state representative or your state senator know what's going on, we can then bring that back to the department and have the potential to fix processes that would make it easier for people to be able to access services.
Absolutely. It's really a big help to us to have people communicate any problems that they have, because there might be something in the computer systems or something in the rules that there's so many that we have to really look at all of the things and make sure that we're reaching people, that we can get them that leg up so that they can move on with their lives and have really productive times with their children and older family members as well. We have a huge group of senior citizens that also are running into difficulty, and that's one of the things that I spent a long time at Legal Services addressing Medicare and Medicaid issues, and we're still doing it at the Capitol. So that's another area that we all work on very hard to make sure seniors are getting the kind of care that they need and the support that they need in the community.
Yeah. And thank you for all you've done over these years.
Oh.
I always learn so much from you, so thank you.
Well, that's so kind of you to say so. I can't think of having more fulfillment than to be able to share the information I've gathered over the long period of time I've worked in these areas with people and be able to work with you. You're wonderful to work with, and Senator Lesser is wonderful to work with, and having you there and having you working so well with the commissioners is just a huge help to all the people throughout our state. So you do a great job, and I am very, very pleased to be able to think about how we can make this change and that change, as you know.
Yes. A favorite activity.
Yes, it is. I said, I got a lot of ideas for this session, and somebody came up behind me and said, yeah, you always have a lot of ideas.
Which is a good thing.
It is, and so do you, Representative Gilchrest. You really do. I mean, you've talked a lot about women's issues and some of the things that you've done at the Capitol. You want to just review some of the things that, like women's health issues, that you have been working on. You want to review a couple of those things?
Sure, yes. So a huge passion for me is women's health and safety, and so I've been involved in a number of policies over the years, including ensuring that victims of sexual assault have access to emergency contraception when they present at hospitals across the state. Most recently, I have formed an endometriosis working group. Endometriosis impacts 1 in 10 individuals with a uterus, and unfortunately, it takes about 10 years to get a diagnosis, and there's no diagnostic except for an invasive surgery and no treatment. And so we formed the work group to raise awareness and also to try and find policy solutions. And interestingly, we are the first state in the country to actually form a biorepository that is leading us towards better information on diagnostic and treatment. I also chair our Reproductive Rights Caucus. One of my jobs prior to getting elected was as the executive director of what was then called NARAL Pro-Choice Connecticut, but have been committed to the issue of ensuring folks have access to all their reproductive health care, including abortion. And unfortunately, as we all know, that's needed now more than ever. We're seeing some pretty devastating things happening across this country, and I'm proud of the work we're doing in Connecticut to protect folks. So those are just a number. The final one, I guess, well, there's many, but one final one is I've had the privilege of chairing our Trafficking in Persons Council since 2016 here in the state. And we meet monthly, bi-monthly, a whole group of individuals from a variety of backgrounds and disciplines to try and address and prevent human trafficking here in the state of Connecticut. And I still think there is an assumption that it's something that happens abroad, but unfortunately, we do have individuals in our state who experience both sexual trafficking and labor trafficking.
Yes, and that was one of the first pieces of legislation that you had introduced to address sex trafficking, and that was with making sure people that went to salons for nail care and that sort of thing were licensed. Yes.
So interestingly, as an advocate, it's been an interesting shift and I've learned so much being what we call, right, like outside the building as an advocate, and then now inside as a legislator. So I had learned that Connecticut was the only state in the country that didn't license nail technicians. And while it's not the only reason we had labor trafficking taking place, in large part, we had become a destination for labor trafficking because there wasn't that oversight. And so we were learning about nail salons where individuals lived above the salon and weren't paid because their work was considered, pay for their rent, or they're only paid based on who they see. And so they sit all day, but they're required to be there all day, and then they only get paid per client. Or wages being taken to cover the cost of their training, just things that don't fall in line are illegal. They don't adhere to Connecticut's labor law. And so had been trying for a few years as an advocate and as chair of the Trafficking Council to get legislation passed, but was running into roadblocks. And so when I first got elected, that was a top priority for me. And lo and behold, I found out that it's not as easy once you're in the legislature, and I was finding it difficult to be able to get a public hearing. But those advocacy skills came in handy, and I knew that if you could say that something is germane to a bill, so if you can link the topic of what you're working on to another piece of legislation, you can speak on it. And so had the advocates and other colleagues who wanted to license nail technicians, we went to a different committee and we spoke at a public hearing on this topic. And because of that buzz and just like continuing to work on it, actually got that passed in my first session in the legislature.
Oh, that's a great work, really, to be able to do that in your first session. That is amazing, because a lot of times, as you mentioned in your book, and the same thing happened to me when I came into the legislature, you weren't, thought of as anyone who could speak up on an issue, even though I was able to deal with brownfields in my first term as part of a big group, a big piece of legislation. As a general rule, you weren't looked at as someone who was going to be able to do much of anything in your first term. So that's great work. And I think it's changed a lot. I think that there's been, over the years, I think that there isn't that feeling anymore that your first term, you're not going to have much to offer. And I think that, and the other thing is, I think we're, in addition to that, more of us are mentoring. So the idea, the leadership has decided that they should have mentors, and the mentors being people who can maybe identify with some of the issues that you're interested in, and that sort of thing. So if you're mentoring someone, I think it helps a lot. It helps them introduce the kinds of things that you can do as a legislator that you might not necessarily know when you first get into the House or the Senate.
And I agree. I think that shift has continued to happen. And it's so important because we're each elected by our constituents, right? And so then we get up there, and for there to then be this kind of power dynamic or like ranking doesn't make sense to those in our community, right, who elected us and think we're at the same level as everyone else in there, which we all got elected the same way. And so I think I agree with you. It's been really wonderful to have that mentoring system in place so that we can help our colleagues who don't yet understand the process to better understand how they get a bill through the legislature in that first year.
Yeah, I'm very pleased to see the change, and plus we get more ideas when people come into the legislature. They have ideas, and then you have ideas that you've developed over the years. That the background and information we have once we're there for a while is very, very helpful to getting more of the legislation through that you may have started out wanting to do. And I have to say thank you so much for working with me on the temporary assistance for needy families process, because I had been working on that since I got it to the Capitol in 2009, and it was very hard to find people willing to take that up as an issue. And I think that we're doing really good work in that area, and I'm hoping to expand it and make sure it's the best possible program for women and children, or family members and children when they run into devastating difficulties economically, like a loss of a spouse or an injury or an illness that can really devastate you financially. And then you need to have some assistance for your family and yourself.
Well, thank you right back. And I love how much you love getting in the weeds on policy, because I love that too. So
I know you do.
It's been great to work together
yes,
and really dive into a policy.
Exactly. Very good. We can start a little bit on, let's just finish up a little bit more about the house, and when we come back after our sponsors give us a little bit of a resource for a show, we can talk about the book, because the book really fits in beautifully with what you're doing today, and I think that it's really beneficial, and I want to buy some for some of my friends and my grandchildren, because I think that when you go back through your history and how you started off, and you get into your family situation and how you develop these ideas, I think it's really helpful for younger people to read what you've put together here. It's very, very inspirational. And so I do want more copies of your book, and I'm going to show people what it looks like, because I brought it here into the studio, and I'm going to show the book, and I know Matt will show the book. And it's called Feminist Advocacy, and we're going to have this gets displayed on CTN, but also gets displayed on the podcasts. And I want to make sure people have access to the book. Now, how can they obtain the book, Jillian?
So currently they can obtain it via Amazon, and it is on Audible, and then we are slowly getting it into bookshops across the state. But right now they could certainly order it on Amazon.
Okay, great. And that is wonderful. And this is an interesting publisher, too. You want to tell us a little bit about the publisher? Because I thought that was an interesting way to have a book published. The Greenheart Living Press. It sounds to me like a great place for people to be able to spread information that might be very helpful to the public.
Yes, they are an independent publisher, women-owned, here in the state of Connecticut. And so they were a tremendous partner and really helped me from beginning to end. And so, yes, if folks are thinking about, how could I write a book, partnering with Greenheart Living Press or another independent publisher is a fantastic way to go.
Yes, very, very good. So when we come back, we're going to talk about feminist advocacy with Representative Jillian Gilchrest, who is an MSW. We will be right back after these messages. All people to read, because you're championing the gender and social justice here, and in order to have a great society, everybody has to be treated well and equally, and actually have a chance to make sure that their needs and their communities are being addressed all throughout our state and our country. So thank you so much for this hard work, and let's talk a little bit about how I was really interested in your history and how you kind of formulated all of this as growing up as a child, and your religious aspects of this that kind of led you into thinking about the differences between males and females and that sort of thing.
Yeah, and thank you so much, and it really means a lot that you enjoyed the book. So my background, and I make it clear, and I'll make it clear here, my background is just that. It's my background, right? And so I am a white, heterosexual, middle-class woman, and so I can't speak for a number of other folks, but the point of the book is to show kind of my feminist journey. And I did grow up in a small town in the rural Hudson Valley of New York. And at the time, what I explain in the book and what I've come to realize is, when you're a child, you don't really, of course, know the context of what came before you unless you're taught it. And the point I make in this book, and what I firmly believe, is we don't do a good job of teaching women's history in this country. And so I was born in 1982, and so I grew up in the 80s and the 90s in the aftermath of, the defeat of the Equal Rights Amendment, in the aftermath of Roe v. Wade getting passed, in the aftermath of Title IX coming into play, and yet my experience was just my experience. I didn't know, that was the context within which I was growing up. And my community that I was being raised in was largely Catholic. I was one of two kids in my elementary school who didn't go to CCD because my parents, kind of out of the hippie era, had decided they would raise us without religion and we could choose, which was fine with me. But in growing up in that situation, my friends and I actually debated abortion from as early as the fourth grade, which, to reflect on, years later, seemed so bizarre. But within that context, they were being taught in their Catholic upbringing how abortion was immoral. And so they bring those views to school. I don't blame them. That's what they were learning. And we would have these debates. And so that, combined with, being educated on stranger danger, I explain in the book, and I truly feel this way. I grew up as a kid thinking, at any moment, a van was going to pull up and I was going to be, pulled in, because that's just kind of how it was. And you were taught as a girl that, you were taught that, your body was going to be used against you by someone if they abducted you, but I yet still didn't know what sex was. And so there were all these bizarre messages, coming out at me all at once as a child and teen. And it wasn't until college where I really had time, when I found women's studies, to process what all of that kind of was about.
That's what I thought was just such a great beginning to teach young women, young girls, about about how to perceive where you are and what your place is in society. And I'll never forget. I don't know how old I was, probably 8 or 10, something like that. And I said to my mother, "Why is it always in the book they always refer to everybody as he?"
Yep.
She said, "That's because it's a man's world."
She was ready with the answer. Yeah, but
she had the answer. Yeah, she did. And so I'm there. What's that going to mean for me? And then I know that when I was in high school, I said, I know that because I'm a lot older than you are. I looked at the paper, right, and the jobs were divided up by male and female. And the amounts that people were getting paid was a lot lower for the females than the males, right, in the newspaper ads, for the want ads. And I thought, well, gee, maybe what I should do is I should learn how to fix cars, because if I could fix my own car, I'd save myself some money, because I'm not going to get paid that much. That's how I was thinking about it. And so I go into the high school. I go to my counselor. I say, hey, can I sign up for shop class? Because I'm probably not going to make that much as a female. And she said, no, females can't go in to shop.
Wow.
Yeah. So it's been, and I was around, before Roe versus Wade as a young teenager, and I remember the thalidomide babies that were born without arms and legs, and that was, I think, part of the thing that maybe got Roe passed in the Supreme Court, because women were traveling to Europe for abortions if they had the thalidomide, which was supposed to help you go to sleep when you're pregnant if you had trouble sleeping, and they didn't realize when they give it to pregnant women that they were going to cause the babies to become deformed.
Wow.
So, yeah. And so, so my mother was always very upset by the fact that this country didn't take care of women's health, and that sort of impact on the little ones when they were born, that kind of thing. Having to deal with that was really devastating for the little ones. So, so that was when Roe got passed. We were quite pleased that women had the access to the health care. And New York State was, I think, the first one that actually provided the access.
Yeah, and what's so interesting, right, like, then it's that history that kind of gets lost. And without that context, then when you're growing up, it's just what you're experiencing, and you don't realize where we've come from.
Exactly.
And it's so important to have these conversations and let folks know how things have been changing, what are the setbacks, just to let them know the dynamics at play, because it then informs what's going on today.
Exactly. And, of course, you go even back a couple of years before Roe versus Wade to the Griswold case that was brought in Connecticut. And that allowed people who were married to obtain birth control, which was not allowed in the state of Connecticut before the Griswold case that went all the way to the Supreme Court. So that was another thing that had been denied women and in Connecticut. And we were from Maine originally, so Mother would go to Maine for the birth control coverage. And go back to her home state, and couldn't get it, while she was here. And anyway, that was back in the day in the 50s. So, yeah.
But it's so interesting when you say, back in the day in the 50s, and it's like, but it's not that many generations removed,
Right.
And so it certainly informs what's going on today. So even like endometriosis, for example,
yes.
Folks will say, like, well, why don't, it could be any number of things, but why isn't there research on women's health? Well, let's explain that process of not too long ago, in federal law, we had to require them to study women.
Exactly.
And that wasn't that long ago. Or, there is a history in this country of policy that distrusts women.
Well, I think that's absolutely very, very true. It has been something that, because of the taking advantage of women, for example, that there was a real gain by making sure women weren't their information wasn't trusted, so to speak. So, yes, I think that has been a way for a lot of the systems not to have to pay for health care for women when they're pregnant, for example. Yeah. Because it really does come down to health care for women. We talk a lot about abortion, but it's really health care access when you're pregnant, so that if you have a difficult pregnancy, you get the treatment. And we have seen now when that occurs in the South, where they've limited access to health care during pregnancy, that women have died or become permanently injured, and they haven't saved anyone with the denial of access to health care for women when they're pregnant.
Yeah, I think in large part the debate over abortion is manufactured to distract from the conversations we could be having about preventative health care for women and access to contraception, sex education, right? Like being able to actually understand one's own body and have control over it comes earlier in the process than abortion.
Absolutely.
I'll always stand by access to abortion care because it will always be needed, but in only focusing on that piece of the debate, we are missing a huge piece of the puzzle.
We are, and I think that I've talked to people before about this, and sometimes people don't even think that the issue of reproductive health care, including abortion, is something that what it's really about. Because how do you regulate the relationship between a doctor and the patient? It's not a good idea. You want to make sure that you've got the public health, statutes and regulations to make sure germs and those kinds of things, and the place is clean and you've got the right staff. But to try and get involved between the doctor and the patient, it's like, especially, as you know, either in the legislature or in Congress, most people are not doctors. Most people are not even nurses, and or they're not APRNs. They don't have the ability to really understand the medical aspects of reproductive care. If they're not even studying the impact of medications on women because they don't get the hormonal differences between men and women, how can they possibly even understand what happens and regulate what happens if a woman is pregnant?
Yeah, agreed. And I think a perfect example of that is, oftentimes when you're discussing access to abortion with folks, people will say, well, I do support it in instances of like someone being sexually assaulted or if a woman's life is in danger, right? That's a common refrain.
Sure.
But as working in policy, it's like, how does that actually play out in practice, right? And I think what we're seeing across this country is that what has been labeled as these exceptions, right, in the case of rape or the life of the mother, are really just restrictions. Because when it comes down to policy, what does a woman have to prove to say she was sexually assaulted in order to be able to get the abortion?
Exactly.
And the medical provider, what are they going to need? How are they going to determine that? And it falls on them, and they might be in trouble. Same thing with the life of the mother. We unfortunately are seeing, healthcare providers waiting till final moments and then the patient's dying because you can't put that into practice.
Yeah. That's right, and that's the problem, because what it does is it doesn't even consider what a doctor or an APRN or somebody who does birthing for women would have to go through to figure out whether at what point is the mother's life in danger, and maybe they make a mistake and it's too late, or maybe they won't know. Maybe there's other problems, cardiac problems. Maybe there's other types of, physiological problems that don't normally come into play until they have a bad pregnancy. So it's a real it's absurd to try and regulate this sort of thing, because it is women's health care. It is the kind of thing that we have technology, we have advancements that we haven't had before when some of these laws were passed back in the 1840s. So I think that if you take a look at the advancements in care, a lot more in the way of little ones are born and born healthy because of these abilities to actually address women's health care when they're pregnant, and to limit that access. Do you want to do that for everybody, both genders? You want to bring them all back to the 1840s, and no more cardiology, no more things in terms of washing your hands when you do surgery? I mean, that's how it used to be, and I don't think that we want to bring people back to the 1840s, because it's really not it's not scientific.
Yep. No, agreed. And that's where, we see that gender disparity going on.
Right. They haven't done that to the men yet.
Yeah.
Just saying. So they get the whole health care and the whole range of scientific advancements, and we're not getting it. And it's not good for the little ones. It's not good for the health of the mom. And it's not good for the medical profession, because we have a situation now where we have doctors fleeing those states where these laws have been passed.
Yeah, agreed.
And so it's really creating a problem in those states. So it's an interesting situation. Moving along and kind of like some of the lessons that you've learned as an advocate here dealing with these kinds of issues, I want to just, moving forward, what do you have for advice for younger people, younger women, younger men coming into, advocacy for civil rights where we are now? Some kind of your concepts about that now.
Yes, and that's another big piece of the book, so thank you. So what I've learned over the years is this context is also important, because it's good to know that when you're speaking with folks, they're not coming from the same frame you're coming from, or they don't have the same frame of reference, and they were raised differently, right? They were taught different things, and many of the conversations I've had at the legislature, so whether it's about abortion or sexual assault, trafficking, endometriosis, they're sensitive topics and they can make people uncomfortable. That in no way should stop you from having the conversation. It's just important to know that going in and to make sure you have outlets, because you're going to hear some wild things, right? You're going to have folks say things that are jarring. But again, it's important, I think, if we want to really move the needle, to be a person, to be an advocate who can, like, hear those things, be able to explain where you're coming from, but do so in a way where there's that open dialogue. So no judgment. I think we see this often, and again, this really isn't a space, well, I'll share about it. I think this is what we're seeing with the trans community. What I see is there's many of my colleagues who are supportive, want to be supportive of the trans community, but they question their knowledge, right? They question how to talk about it, or they were raised a certain way or learned certain things, and so it's a complicated issue for them. And so I think when we can come into that space recognizing that these aren't easy conversations, these are going to be difficult, but we come from a place of not judging, of being open to that conversation, I think that's when you can actually be able to move folks. Yes. I also speak a lot in the book, and I firmly believe that as advocates, we really need to have our messaging tight. And what I mean by that is really take time to think about the issue you're working on and how best to deliver your message. It doesn't need to be canned. It doesn't need to be these canned talking points. I actually think that the public is sick of that. When folks, when politicians kind of just keep repeating the same talking point and don't answer the question. That's, yes. No one wants, that's very frustrating. But taking time to figure out how to best talk about the issues you care about in a way where you can actually get through to folks, I think is incredibly important, because in today's day and age where you don't really have too much time to get your message across, thinking that through and being very concise and having intention behind what you're saying is important.
It's very, very important, and it's something that a lot of this, I think, whether it's women's health or the trans issue, a lot of this is science, and it's really comes under that area where we really need to take a look at the science that's involved in these kinds of biological issues, and we have a lot of answers, and we're getting more and more, and we're going to work on this, but I'm running down to the last minute, so I'm first going to say, everybody, if you're looking to buy this book, it's called Feminist Advocacy. It's written by Jillian Gilchrest, and I'm holding it up again so that they can see this as part of the show. And I'll give you the last 30 seconds to make a few remarks, Representative Gilchrest.
Well, thank you so much for having me. I wrote the book because I just, again, think we do a bad job teaching history, and so it really highlights some key moments that are important for folks who want to do this work. It gives some tips on advocacy, and I really encourage anyone who's thought about it. We need more pro-choice Democratic women in office, so please join us.
Absolutely. Thank you so much for being on Let's Talk About It, Jillian Gilchrest. And talk to you all next week, and join us for another great show.